Thank you very much for taking the time to speak with us today.
Sure.
I want to begin here because I think obviously this is the thought that's on everyone's mind right now, and that's COVID-19, the pandemic we're in.
Sure.
So, given that, could you talk a little bit about some of the challenges specifically facing the VA navigating through COVID-19 right now?
Well, the good thing about VA is that we serve 9.5 million people who are used to being in the toughest spots on the planet. And we started early getting the information out to them, and they have responded magnificently. So, of those 9.5 million, we have 16,000 who've been infected, but well over 12,000 have fully recovered. But what we did have to do is make very tough decisions at the beginning of this. And I think this is a roadmap for the rest of the country. We stopped elective surgeries, we stopped visitors, we closed off, sadly, all of our nursing homes to families and friends. And in so doing, I think we went a long way to protecting the lives of our most vulnerable veterans. And it really comes down to making difficult decisions early in a crisis.
Definitely. Is there anything that makes perhaps navigating through Veterans Affairs, particularly, makes that unique to a pandemic like this? I know some veterans maybe have specific, conditions, no different than hospitals, but maybe just it's a different environment. If you could maybe speak a little bit about the unique elements for doing this.
It's the unique population, and the good thing about what we've been able to do is that for those veterans who had normal appointments, wellness appointments, or who had physicals, we stopped those, but we kept in contact with them, and we've started slowly to bring them back. But the other part of this that our veterans have responded magnificently to is expanding telehealth, reaching out, particularly in rural Pennsylvania, to those veterans who we don't want them to come in to endanger themselves or their friends, but we do want them to be in contact with us. In a normal month, we have over 40,000, just about 40,000 mental health teleappointments. We've gone up to 900,000 in the month of April. So that means our veterans are receiving our care, but they're receiving it in a way to protect themselves, and they're receiving it in the comfort of their homes. So that's a very important change in the way we do business.
You hit the nail on the head there, especially in central Pennsylvania, as you're probably well aware, a lot of rural areas, still a lot of veterans that need that care. Can you give some examples, further examples of just a few quick ones that come to mind related to telehealth? Obviously, mental health a key one, but some of the other maybe perhaps new programs that you have.
Well, the telehealth is the most important one, and we're not only setting up for the present, we're setting up for the future. What's going to be coming to Western Pennsylvania in the next few years is VA's partnership with organizations like Walmart, where a veteran will be able to go to a Walmart, go behind the pharmacy counter, and sit in what looks like a living room and contact Veterans Hospital in Philadelphia, Veterans Hospital in Pittsburgh, or wherever the particular expertise that veteran needs is available. So that's the important part of this as we expand our footprint. But in addition to that, we are continuing to make sure that our veterans know that, particularly on the mental health front, that we're serious about same-day mental health. All people have to do is call us, call our Veterans Crisis Line, and then we will get the information to them, and we will get help to them if they need it.
On the mental health front, have you seen maybe perhaps a difference in approach or even an increase in needs just because of this pandemic? Some people like just the social person-to-person interaction gives some people comfort on that front. How are we dealing with that now? Are unfortunately, some folks maybe being further, negatively impacted by not having that? And how are we dealing with that right now?
So we've sent out tens of millions of communications to make sure that we do our best to capture that sentiment amongst our veterans. But what you're going to see now, particularly in Western Pennsylvania, is that we are revamping our operations. We never closed, but we're getting them back to normal. And we will determine if that face-to-face interaction between a veteran and the healthcare provider. It can be done in a safe way, but we're ramping up in Pennsylvania, and that's a good thing. But we're also preparing in the event that this thing boomerangs back on us. Right now in Altoona, we have no patients in our hospital who have the virus. We have patients in our nursing home who have the virus. That's a good thing. So we do have that capability to respond in the event that things explode on us again.
That's great to hear. You mentioned obviously Altoona, that key number 0 is great. Expansion, I know that's another topic that, some VAs, some more than others, have been struggling. Is there still, even in the midst of this pandemic, plans, maybe not right now, but perhaps in the future, to continue expansion to ensure that these VAs still exist, so to speak?
Sure. Absolutely. I presented the largest budget in the history of the department to the Congress, $240 billion. I expect next year's budget to be even greater. We're going where the veterans are, and the politics of veterans has changed. One place it hasn't changed is Pennsylvania, particularly Pennsylvania between the two great cities. You still see that huge number of Pennsylvanians who serve in the military and then who come back home. So I expect when all of the studies are done, Pennsylvania will get richer in terms of veteran services as some other parts of the country contract. But I don't see that happening in Pennsylvania.
Great to know. Any other issues that you see? I know obviously you have the entire nation to cover, but in our central Pennsylvania area is a very small slice of that pie. But any other issues that you see at the forefront, especially for folks in our viewing area in particular?
Well, I thank you, and I thank you for reaching out to us. I want people to call us. I want people to call if they need help. But that's not just veterans. That's families and caregivers. The one thing that happens when an American joins the military is that the entire family joins. And at VA, unlike any other healthcare system, we actually reach out to the families who are the partners in the veterans' care. So if they have a question, call Altoona, we'll respond, and just follow the instructions, and everybody will be safe, and we'll get back to normal as soon as possible.
I want to thank you very much for your time, Secretary Wilkie. Go ahead.
And I will give you a final thought on Thursday. Our Deputy Secretary, Colonel Pamela Powers, will be in Altoona to take the message that I've given you to the veterans and to the wonderful people who are at the VA Medical Center there. And we're very glad that she's going where the veterans are.
Well, thank you. Yes, obviously, great to hear that the health is continuing to thrive here, and case numbers are continuing to go down here as well, which is great to hear. I did want to ask a final thought, if you would care to comment on this at all, related to Clarksburg, West Virginia. The cases there, obviously related to some insulin, other things. Any update as to where you are with that case right now?
Well, the sad thing about the Clarksburg incident is that this is an investigation that began before I was secretary. And I didn't become secretary for the first full day until August 1st of 2018. So we have been very disappointed in the way this investigation has been carried out. The people of Clarksburg and the people of Pennsylvania who were served by Clarksburg needed and deserved better. My understanding is that this is in the hands of a grand jury in the Justice Department. I don't know any more than that, but the sad thing is that it has taken this long, and we are very sorry for that, particularly for our veterans and their families.
I appreciate you addressing that. So as of now, you don't know of any charges?
No, I wouldn't, because that's, as you know, from covering courts, that is a process that is closed to the rest of us.
Well, thank you. I appreciate your comments on this, and Central Pennsylvania thanks you as well.
Thank you, and good luck to you.